Last year was a good year for flu. There was relatively little flu about, and I think that's partly down to the fact that we'd had a couple of years where flu had been spreading and people had acquired some immunity. But I think it was also down to the fact that we achieved historically very high uptake rates of vaccination, and in particular Stockport did very well and was highest in the country for this. So I think those were the sort of two factors. Where we didn't do quite as well was in the age group 6 months to 64 years, and particularly in children 6 months to 16 years. Our uptake figures there weren't as good as they should have been, and therefore the bottom line is there were children out in the community with risk factors who were susceptible to infection. And you've got to remember that this susceptibility to infection is a sort of nice doctor way of saying you can get the disease and you can die. In 2009, more children died of influenza infection than died of leukemia. In 2009, during the swine flu episode, there were 13 deaths in children under 1 year of age. And potentially these are all preventable conditions. What are the risk factors? If you've got a child, because remember, you have to make this decision. You have to say, I want my child to be immunised and I need to take my child along to the practice to get that vaccine. So this is down to you to do this. What are the at-risk conditions that predispose children to flu? Chronic lung disease. So, for example, if your child has asthma and is on continuous inhaled steroids, or if your child's been admitted to hospital in the previous 12 months, or if your child's required oral steroids in the last 12 months, these would be criteria that we would use to judge that a child should have influenza vaccine. If your child's got chronic heart disease, and that tends to relate to congenital defects that are evident at or around the time of birth. If a child's got chronic liver disease, chronic kidney disease, any neurological disease, if you've got a child with diabetes, if your child's immune system has been diagnosed as not fully functioning, or if your child is on particular medications that suppress the immune response. Now, for a number of these, particularly those under secondary care in hospital, you need to speak to your consultant, you need to speak to your GP, and you need to get clarity about whether they need the vaccine. But if they do, you need to then make that decision, go along to your GP and get the vaccine. Half of all the children that we would want to have had a flu vaccine actually received it, but half didn't. And the important thing we have to do is to make sure that all children receive it. This is a dead vaccine. The virus is a ball with little spikes on the outside, and it's the spikes we use to make the vaccine. So it's just bits of the virus that we use. In children, this is an incredibly effective vaccine. It stops them getting flu. The older you get, the less likely it is to stop you getting flu. But in children, it stops you getting flu. It's a highly effective vaccine. Depending on whether you've had the vaccine before, it's a 1 or 2 dose schedule. For people who've had the vaccine before, it's just a 1 dose each year. And the reason for the dose each year is because the viruses change ever so slightly, and we have to modify the vaccine to take account of the changing virus. Doesn't everybody have the vaccine? I think the sorts of reasons that I hear are people's parents, in this case, parents' concerns that the vaccine can cause flu. Well, it doesn't. It's not a living vaccine. It cannot give you flu. And the evidence is really, really secure for that. I think other concerns parents may have relate to the side effects associated with the vaccine. And you do get some side effects, but virtually all of them are relatively mild, in the sense that at the vaccine site, so if you give it in the arm, it can be tender, little bit of redness coming on within about 24 hours and lasting for a day or two, usually doesn't require treatment, and about 1 in 10 people get that. A similar proportion will get a fever and a headache, but again, these tend to resolve without any treatment. And those really are the predominant side effects associated with the vaccine. I think another reason why parents may not have the vaccine is they'll say, well, my child's got a normal immune system and isn't at risk. And whilst that argument may well work for the majority of children, if you're in an at-risk group, chronic lung, chronic heart, chronic kidney, children with diabetes, any of the immunosuppressed, if you're in any of those groups, I don't think that argument really holds up as well. And you are putting your children at much increased risk if you don't have a flu vaccine in a child with one of these risk factors. General practitioners are well aware of the importance of flu vaccination in at-risk children, and every year they make their services as available as possible. And I think you'll find that there'll be clinics during the day, may or may not be possible because of work commitments, but in the early evening, and they'll also offer vaccination at weekend. So I think, and I'm sure that if you talk to your general practitioner, he or she will make the necessary arrangements, because they recognise how really important it is that at-risk babies, infants, children, adolescents get the flu vaccine. What about the situation where you've got a child who is going to cry? And yes, that does happen. Again, the procedures that we use to try and make sure that children experience as little pain as possible and as little as discomfort as possible are improving all the time. And everybody involved in vaccination of children makes every effort to ensure that it's as painless a procedure as possible. We try and cut down any distress to the child or the parent as much as possible. And I would be confident that in the hands of a skilled practitioner, this is a relatively atraumatic and non-distressing procedure.